This was an attempt to include patients in a study to assess the patient journey for patients with NMOSD, beginning with the onset of their symptoms all the way through to treatment. And the approach is going to be integrating the patient experience and their narrative into a paper, and even including them as authors. This is a different type of study in which we're not just reporting what patients are telling us, but we're actually facilitating the patient's report in a publication that they are participating in. This was a study where we recruited NMOSD patients online from our clinic and from our Facebook group, our social media pages. Patients had to be positive for the aquaporin-4 antibody, and we verified that prior to enrollment. And then they completed a comprehensive survey, either in English or translated into Spanish. And the survey reviewed all aspects of the journey, including their frustrations and difficulties in getting the diagnosis and in getting the treatment sort of beginning to end. And what we ended up with was a nice group of 151 patients. And the race breakdown was 76% white, 7% Asian, 7% African American, which I should admit does not accurately reflect the NMOSD patient population, at least in the United States, where African Americans are far more overrepresented in the NMOSD population compared to the general population. However, given what we were able to conclude from this survey, we found that the average time to diagnosis was 2.2 years. This included patients who were diagnosed many years ago and patients who were diagnosed more recently. Based on our experience, we found that diagnosis is more rapid more recently due to the widespread availability and knowledge about the aquaporin-4 antibody. However, during this time when patients are not yet diagnosed, there's a lot of, the initial reaction is fear and shock and frustration, getting through the medical system to finally get a rare diagnosis that's based on an accurate and reliable biomarker, the aquaporin-4 antibody. There's still a lot of frustration in getting to that point on the patient's side. Unfortunately, the first interaction with the healthcare system was felt to be not helpful, according to the patient's surveys, or somewhat helpful. More than 70% reported that designation of either not helpful or only somewhat helpful. It takes some time to get to a specialist, a neurologist, or neuroimmunologist, and it was then the patients were diagnosed, and that's when they found their healthcare professionals to be helpful. Obviously, getting a diagnosis and starting treatment provided hope to these patients. And despite that, though, there were still challenges. Of course, patients, even after they start preventive treatment, still have all of the issues from previous attacks, including pain, spasticity, disability, and there's still challenges in treating all of those issues, even after they're started on preventive medications. So those are the ongoing issues. Of course, with the COVID-19 pandemic, all of that is exacerbated. Access to care is more difficult. Access to specialty care is even more difficult. Now, as we emerge out of the pandemic, I'm hoping that some of those COVID-19 issues will resolve. So just to summarize, this was a study of patients with NMOSD on their journey from onset of disease to diagnosis and treatment. And what I think is the real novel feature about this study is that patients were involved from beginning to end in helping craft the survey in completing the survey, and they're going to be involved in generating the manuscript and will be authors on this manuscript.